I'm going to be one of the nurse practitioner students who's going to be helping take care of you today. Is that okay?
Mm-hmm.
Is it okay if I record you for this assessment?
Yes.
Perfect. I'm going to wash my hands for your safety. Can you tell me your name and date of birth?
William Gregory, 5/13/96.
It's nice to meet you, Mr. Gregory. So today I'm going to be assessing your heart and lungs for anything abnormal. So this exam includes me looking at your chest, touching and feeling your chest to make sure there's nothing abnormal, and then just listening to the front and back. Is that okay?
Mm-hmm.
All right. So first I'm going to start with the front of your chest. So if you will, just open your shirt up for me. So I'm just going to take a look at the front of your chest. I'm going to feel the skin, take a look at the skin. So the skin on the anterior chest is smooth, warm, dry. There's no rashes or lesions or bruising noted. There's also no deformity of the chest noted. You can just breathe normally.
Okay.
The chest is symmetrical. Next thing I'm going to do is I'm just going to touch your chest and you just breathe normally, okay? Go ahead, breathe in, breathe out. Perfect. Breathe in, breathe out. Perfect. So the chest rises and falls symmetrically. So the next thing I'm going to do is I'm just going to touch your chest and you just breathe normal for me, okay? Go ahead. Good. And one more time. Great. So the chest rises and falls symmetrically. Next, I'm just going to touch your chest and you just say 99.
99. 99. 99.
Perfect. So there's expected tactile fremitus noted on palpation to the anterior chest. The next thing I'm going to do is I'm just going to listen to your front part of your lungs, okay? I've cleaned my stethoscope for your safety prior to this exam. And we're going to listen with it to the diaphragm of the stethoscope. All right?
Mm-hmm.
And just breathe normal for me. And again. Good. Again. 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 Good. And again. One last time. Great. So there's no adventitious breath sounds noted, such as wheezing, rawhide, crackles, or stridor. So next, I'm just going to listen to right in here, okay?
Mm-hmm.
And just breathe. Good. So there's no adventition sounds to the tracheal area. So for the next part of the exam, I just need to take a look and listen to the back of your chest. Go ahead and stand up for me. Take your shirt off. And then you can just have a seat. Take it all the way off. So right now, I'm just taking a look at your back. The skin is warm, dry to the touch. There's no rashes or lesions noted to the back. No bruising or any deformity noted. So the next thing I'm going to do is I'm just going to touch your back, okay? Just breathe normal. Good. And again. Good. So the AP diameter is 2:1. Chest is symmetrical. Breathing is regular, even, and unlabored. There's no accessory muscles used. He's not tachypnic. He's not tripoding. There's no cyanosis noted as well. All right, I'm going to put my hands back on your back, and then I just need you to say 99.
99.
Go ahead.
99.
Perfect. One more time.
99.
Great. So there's symmetrical and expected tactile fremitus notice on palpation. Next thing, I'm just going to tap on your back, and you just stay there, okay? So So percussion sounds are resonant. Any tenderness when I tap right here
No.
or here?
No.
There's no CVA tenderness noted of either. So I'm just going to listen to the back, okay? Deep breath in. And out. Good. In and out. Good. In and out. 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 And one last time. In and out. Good. So there's no adventitious breath sounds noted on the posterior chest. No crackles, wheezing, rhonchi, or stridor noted. Alright, so next I'm going to listen, and you just, when I say E, you say E, okay? Say E.
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 So there's negative agophony noted. Alright, next just say 99 for me, okay? Go ahead, say 99.
99. 99.
99.
99.
99.
99. 99.
So there's negative bronchoscopy noted. So next, you just need to whisper baseball for me, okay? Go ahead. So there's the negative whisper pectoraliquy noted as well. I listened to the tracheal breath sounds and there was no adventition sounds. Vesicular breath sounds are clear. There's no wheezing or stridor noted either, as well as the bronchovesicular. So patient's breathing is regular and even and unlabored. Patient's breathing 17 times per minute. There's no accessory muscle uses, no retraction, no nasal phlegm, no tachypnic, he's not tripoding, and there's no cyanosis noted. So the next thing I'm going to do is I'm just going to listen to your heart. Is that okay?
Mm-hmm.
And I'm going to listen with both sides of my stethoscope, so the diaphragm and the bell, okay? So the patient's heart rate is 77 beats per minute, normal sinus rhythm, no gallops, murmurs, or any extra sounds noted. So we listened to the aortic, the pulmonic, Erb's point, tricuspid, and mitral areas with the bell and diaphragm of the stethoscope. So next, I'm just going to look at your chest. So the PMI is located at the midclavicular and the fifth intercostal space. So that's where the PMI is. So since we found the PMI at midclavicular at the fifth intercostal space, I'm just going to listen to the apical pulse for a full minute, okay? apical pulse rate is 77 beats per minute and it's normal time. Alright, so now I just need you to lay back for me. Great. There's no hives or lifts noted on his chest when he's just laying flat. I'm just going to feel the same spots I listened to. So the aortic, pulmonic, Erb's point, tricuspid, and mitral area. There's no thrills noted to palpation. I'm going to re-listen to all those spots while you're laying back, okay? I'm going to listen to the aortic, pulmonic, Erb's point, tricuspid, and mitral. Alright, now I'm going to listen with the bell of my stethoscope. I'm going to listen to the same 5 spots again. Great. Stethoscope, their rate is 74. Normal sinus rhythm, no gallops, murmurs, or extra beats. No. So now that you're turned on your left side, I'm going to listen to one more spot on your heart, okay? We're going to listen to the apical pulse, or the PMI. So the PMI is located mid-clavicular, about the 5th intercostal space. So I'm going to listen to this for a full minute, okay? So the apical pulse is 70 for normal sinus rhythm. No abnormal sounds heard it, like gallops, murmurs, or any extra sounds. So for the last part of my exam, I'm just going to look at the vein in your neck to make sure it's not elevated or distended or anything, okay? So we're going to find the sternal angle, and I have my ruler here. We're just going to measure from his jugular vein and find where it matches up, and it's about 2 centimeters above the sternal angle. So I've completed my exam. Do you have any questions about anything that I've done today? Okay, thank you. Have a great day.